Good morning, everybody. Welcome to Bottom Line Thursday. Brad Johnson here.
Hey, Brad. Chris Meyer.
And Brad, it's Chris Bowling to join you today.
Nice to meet you again, gentlemen, even though I just saw you not too long ago.
So, always good to connect.
Always a pleasure. Always a pleasure. Well, would you like to talk about a change going on if you're an Illinois fully insured customer?
We have a few of those.
Yes.
Got a couple of those. All right. So just for the sake of making sure everyone watching this is on the same page, there's a process out there in most pharmacy plans called step therapy. And it basically requires, as you guys know, but I'll help the audience here, requires really the person to try a lower cost yet effective medication before they can jump up to try the higher cost one. So let's say you're diabetic, might try metformin first before going to Ozempic. And that could be something that they would do through this step therapy. Well, Illinois, as of January 1st, is saying you can't do that anymore. Step therapy is now banned. Keep in mind, though, it's only for fully insured customers. So if you're self-funded, mandated by ERISA, most typically, that would not apply to you. But that's a pretty big change and pretty controversial, too. You think about that just, to me, makes a lot of common sense. So I'm going to pause there.
Yeah. As somebody that is in Illinois, I can say that I've noticed that there's been a lot of change from the state level trying to make access and process of healthcare simpler. And this is the intent. It did not look at the cost savings aspect where we typically see step therapy working. Is truly, if a member's doctor says they know this is what they need, don't make them go through 4 different versions. I don't think that's the common scenario. I think that's probably an outlier, but that was the thought as we read more about that brief, that making it simple, you don't have to go through all the hoops in order to get the medication your doctor says you know. Flipping that, it's going to cost a lot more. For our Illinois clients.
Yes, and your governor also now is going to require everybody to pay for weight loss medication as well. Yep. So yeah, so let's go back to last week where the ACA trend was 7 point whatever percent. Next year it's going to be 17% in the state of Illinois. So yeah, I mean, you can't have it both ways, right? I mean, if you want wide open access with wide open RX formularies, great. You're just going to have to pay for it.
Yeah. Well, I think we get so many questions too. I'm sure you do as well, Brad. We've got an employer in Iowa with Illinois employees. They're fully insured. They're self-funded. How all of this applies, because we'll get an email every other week. This just was updated in this state. What do we have to change? Well, it depends on your funding mechanism. And I think that's a big thing to keep in mind for our employers that are on the border.
Yeah, as I dug further into this, they had interviewed a few PBMs, and some are even considering implementing prior authorizations for drugs that used to just be on step therapy. So it's kind of like, you're going to take away my left hand, I'm going to give you my right. And, some of that's going on. Who knows if that will be fully allowed, but and I get it. If they're
so what's Brad, for the audience, the difference between step therapy and then prior authorization? What is that?
Yeah. So, the prior authorization process is basically saying, if this is the drug you want, you could have it as long as our medical team and your doctor can have a discussion basically and agree that that's the right thing for you. But if it doesn't pass that test, you're not getting it. Yeah. So it'd be another way to make that drug a little harder to get. And oddly, might serve about the same thing as step therapy. So I'm not sure how much that legislation will really curb some of that. We'll see. I don't know if I mentioned it too in the onset. This will go into effect January 1st. Yeah. So not mid-year, January 1st. The one last little tidbit on some of the Illinois changes. They also they put into place in this law as well that you can't require prior authorization for emergency mental health care. I don't think anyone would disagree with that.
Right.
You need it.
I didn't even know that could be a thing. I would agree that needs to be in place, just like that. Yeah. I mean, that you can't control a situation that needs to be treated.
Yeah, and I can't say I've run into situations where carriers are imposing that. I'm sure it must have happened to come about in the law, but of the two things that stood out to me, the step therapy was the big one.
Wow. Interesting. Well, I think more to come as we still see our different states we work in make legislative changes, but thanks for summarizing again, Brad.